Everyone. My name is Maria Mendez. I'm the training and technical assistance man. No, that's Sierra. I keep doing that. I'm the strengthening sexual assault services project director with CCASA. And I have been with CCASA for about 4.5 years now, which have flown by. I'll turn it over to my colleague and co-presenter Itzel to introduce herself.
Good morning, everyone. My name is Itzel Olivas, pronoun she, her, ella. I'm the Rural Program Manager here at CCASA. Prior to this position, I was the Latina Outreach Coordinator and bilingual advocate for a small dual agency here in Colorado. And I've been with CCASA for the last 3 months now, so I'm excited to be here with you. I hope you enjoy this presentation. Thank you.
Awesome. Thanks, Itzel. So really quickly, before we get started, we wanted to give a couple caveats. So this specific training was created for DVP-funded programs through the Sexual Violence Services Project, but it is open to everyone. We have made it so that it's wide enough so that if you're thinking about organizational assessments, if you're thinking of evaluating your work with DEI, this is going to be great and doesn't just apply for DVP projects, but I did want to let you all know that focus that we have. We also wanted to mention that we as CCASA are more familiar with SADI, the Sexual Assault Demonstration Initiative. We have worked with ACRTI. We have the overall understanding. We've done a lot of reading and a lot of research, but we are happy to, if we don't have an answer to your question, we're happy to find that at a later point, especially with ACRTI. And I also see that Brandy from Violence Free Colorado is on the line as well. So Brandy, please feel free to jump in if we don't know something about ACRTI, since that's something that Violence Free Colorado works very extensively on. So just wanted to give that caveat as well. Great, so let's go ahead and skip through these next slides that we already talked through and get started. So for those of you who are not aware, which I don't think is many of us on the call, we just wanted to share a little bit about CCASA to remind y'all that we are a membership-based organization. We essentially call ourselves the advocates of the advocates. So we don't do direct service, but we support you all in the work that you're doing through training, through technical assistance, and policy work. So you all tell us your trends that you're seeing, the needs that survivors are seeing, and the needs that you have, and we help support you all and advocate to you in the best way that we can. We also wanted to mention that we are the official TA providers for the Sexual Violence Services Project. Sorry, another caveat. I'm still recovering from long COVID, so my vocabulary is a little bit off. So we are for the SVSP project. So for those of you who are DVP programs, feel free to reach out to us as you're working through that project. So we want to know who's here. If you could, in the chat box, please put your name, your pronouns, if you feel comfortable, the agency that you're with, and the role that you have at the agency. And we will also launch a poll. We want to know which of you are part of a DVP Sexual Violence Services Project program. So you'll see when that launches, you will see a yes, no, or unsure of whether you are part of the DVP Services Project. But please do introduce yourself in the chat box. Welcome, Brandy. Happy to have you here. Brooke from Arkansas Valley Resource Center. Great. Amanda from Saba, Julie, welcome. Welcome, everyone. I'm seeing a lot of DVP, SVSP programs. Awesome. Welcome, Carmen, to our CCASA board member. So good to see you, Maria. Welcome, Selena. Awesome. Keep introducing yourselves in the chat box. We're so happy to have you all here, and are hopeful that this training isn't too technical and we can make it kind of interesting, but we know what it's like with frameworks, right? So we will try to hopefully make this useful for you all. Welcome, Veronica. Awesome. So Sierra, what is that poll looking like as far as DVP programs?
Hi everyone, this is Sierra. So it looks like we have about 67% are DVP SVS project programs. We've got about 20% no and 13% unsure.
Great. Awesome. That's a really good mix. I'm happy to see folks that from the DVP project, but I'm also happy to see folks that aren't part of that, because EDI work, looking at your equity, diversity, and inclusion work at your organization is core, is key. And we'll talk about that particularly with, with both ACRTI and SADI, the accessible, culturally responsive, trauma-informed framework of how it has to be key. So I'm so excited to see all of you here taking this on. All right, so we're going to go to the next set of polls. We kind of want to know where we're starting, right? So if you could, on the first poll, let us know if you've heard or used the ACRTI framework, the accessible, culturally responsive, trauma-informed framework. So we'll give you a bit to respond to that. And your options will be, yes, I've used it. Yes, I've heard of it, but I haven't used it. Or no, I haven't heard of ACRTI. And Sierra, if you can keep us posted on what that's looking like.
This is Sierra again. Yeah, so we have some responses coming in. So it looks like to the first question, have you heard of or used the ACRTI framework? We've got about 47% who say, yes, I have used ACRTI. We've got about 35% that says, no, I haven't heard of ACRTI. And then in the middle, we have about 18% with, yes, I have heard of ACRTI, but haven't used it.
Great. And you said 20% that haven't heard of it?
About 18% right now, yeah.
Perfect. Awesome. Cool. So we've got a pretty broad spread as well here. Now let's move on over to the SADI framework. How many of you have used or heard of the Sexual Assault Demonstration Initiative framework?
This is Sierra again, and it looks like we have about 18% that say they have used SADI. We've got 41% who say, yes, I've heard of SADI, but haven't used it. And then 41% as well for no, I haven't heard of SADI.
Perfect. Awesome. This is expected, right? I mean, I think SADI is so new, and we at the coalition are still developing and evolving on how programs can use the Sexual Assault Demonstration Initiative. So this is helpful to know as far as our framework review, how much in depth we will go on each of them. So thank you for participating in that poll. And we will get started with a framework review. So like I mentioned, we're more familiar with the Sexual Assault Demonstration Initiative, since it is focused on sexual violence specifically. Just really quickly, SADI, I'll be calling it SADI from here on out, was created by the Resource Sharing Project and the National Sexual Violence Resource Center. And they created it to enhance sexual assault outreach, services, and community partnerships, particularly with dual and multi-service programs. But it can be very useful for our standalone programs in the state if you are a standalone program for sexual violence. What it really does is it asks our movement to be critically self-reflective about the ways we have structured our organizations and service models in regard to serving survivors of sexual violence across the lifespan, right? So there's a lot of pieces there. It's all about critically looking at what we are doing, why we are doing it, and how we can do that better, right? So the SADI worked with 6 sites across the nation, and it was a 4-year process. They did a lot of assessment, they did a lot of planning, they did a lot of implementation of enhanced services and capacity building, and they had a lot of support, right? It was a really in-depth project, kind of similar to what we're doing with DBP, with the domestic violence program. So they had a lot of training, intensive and in-depth technical assistance. They had networking across sites, and a lot of collaboration between staff, technical assistance providers, and the OVW program, the Office of Violence Against Women program managers, to really get this off the ground and give us a pilot and a framework for what works best for enhancing services, sexual violence services. So we feel that this is really great for the work that we are doing, right, for sexual violence. We know that sexual violence and domestic violence are similar and that they overlap a lot, but we also know that there are some differences, some key differences in providing services for survivors of domestic violence and sexual violence. So we do have this link here for the final report. It's a super long report. I think it's like over 100 pages. So we don't expect you to read the whole thing, but it does really have some of those key things that you might want to read about the main lessons learned. And if you're interested, if you're a data person and you're interested in how they collected it and all of that, we do recommend that you take a look at that report. So these are some of the ways that we have visualized SADI as far as the key focus. So at the center is always a survivor, and it's always holistically. For those of you who already are aware of ACRTI and have heard of ACRTI, we can already start seeing a lot of similarities, right? We have the holistic survivor focus at the center. We have our anti-oppression, anti-racism framework. It's empowerment based, it's rooted in trauma-informed care, it's accessible in a wide range of settings, looking at systems, and it's culturally rooted, right? And we'll compare this with ACRTI side by side as well. So some of the key lessons learned from SADI were things like, in order to provide effective services for sexual violence survivors, it has to be rooted in an anti-oppression and an anti-racism framework, and the organization has to be committed to that, right? We know that survivors of sexual violence experience it differently or at different rates, depending on the intersections of their identities. And so we really have to, and heal depending on the intersections of their identities. So we have to really pay attention to that and have that central to the work that we're doing. Another major thing, again, we mentioned this was primarily for dual and multi-service organizations. And they showed that in order to provide the best sexual violence services, that the organization had to have a clear identity as a sexual violence program, right? You might be familiar, you might be thinking, oh, wow, as we go through this, I hadn't thought about that. You're right. We don't have as much information on our website about sexual violence if you're a dual program, or we don't have things on our brochures, or, you know, word of mouth in the community is that, yeah, they do domestic violence situations, but I didn't, or services, but I didn't know they did sexual violence services, right? So it's really important to have that clear organizational identity as also providing in an equal and equitable way to survivors of sexual violence. We see that through SADI, policies and procedures that have sexual violence services as integral, not just in addition to, right? So oftentimes we see that sexual violence services are just added. It's just the word added to domestic violence and sexual assault, and nothing else changes. But like I mentioned, we know that there are differences between what domestic violence and sexual violence survivors need. And so that has to be reflected in our policies and procedures. SADI also found that leadership is so important. This is probably not surprising to a lot of us, right? But they focused on stable and empowering leadership, right? Being able to have consistency in the organization. And we know how difficult that can be with so much turnover that happens. We know that leadership needs to be empowering to the people on the front lines doing the direct service, right? And we also know that we need to provide and take care of our staff. We need to support them because it's hard work. And for them to be at their best means that they're providing the best and most enhanced services for sexual violence survivors. So we're going to talk about those in more detail here in a bit. SADI also found that it is key to have the foundational, like in Colorado, that 30-hour sexual violence, sexual assault training, advocate training, and ongoing training, right? We might see this as well as far as if we don't feel prepared, if we don't feel like we have the information, and again, we know that sexual violence is similar, but it also has its differences. There needs to be opportunities to have ongoing SA specific training. So evaluating, looking at what does your training look like? How much of your onboarding training is related to sexual violence versus domestic violence, right? So really taking a look at those pieces. It also found that we need to be holistic, like we said earlier, right? We have to be responsive to those multidimensional needs, not just the trauma of sexual violence, but addressing the physical, social, emotional, and spiritual needs, not just of the sexual assault survivors, but their families and allies and their support system as well. Again, often in a different way than what we see support means for domestic violence survivors. We do see that similarity, though, as well with ACRTI. In terms of the physical, social, emotional, and spiritual needs. And a huge thing that SADI talks about is that we must, as an organization, and particularly leadership, embrace change and growth. We have to admit that we don't know what we don't know and be willing to learn and grow. Because without that, we're not going to be able to better the services, and we're not going to be able to even start making changes. We want to invite you to, if you're interested in learning a more in-depth dive look about SADI, we will be having a webinar March 22nd. That is like an intro to SADI. We have some of the folks who worked primarily with the SADI while they were developing it, who are coming to talk about what it is, what more detail of what they learned, and how you can implement it in your program. So we invite you March 22nd, 10 to 11:30. Registration is not open yet, but it will be within the next week if you're interested in that. So now let's talk about ACRTI, accessible, culturally responsive, trauma-informed training or framework. This was created by the National Center on Domestic Violence, Trauma, and Mental Health. And I will probably not call it that again. I'll probably just call it the National Center because it's so long and I don't remember it. So the National Center, they created this as a way to bridge trauma-informed and advocacy perspectives. Again, we see that similarity with SADI in terms of that trauma-informed piece, but really making it about advocacy. What they did was they wanted to ground it in the advocacy. They wanted to incorporate trauma and its effects that creates accessible environments for healing, recognizes centrality of culture, attends to well-being of staff, organizations, and communities, and is committed to social justice and human rights. So we're hearing so many similarities between SADI and ACRTI in terms of what the focus is. ACRTI has 7 focus areas that we see here. So we see that they, in the toolkit that we're going to talk about, they focus on an organizational commitment and infrastructure to these changes to ACRTI, to being accessible, culturally responsive, and trauma-informed. They focus on staff support and supervision, physical, sensory, and relational environment. And what relational environment means is like the relationships we have with each other, both staff, with survivors, with our community, what that feels like, what that looks like. Does it feel safe? Does it feel welcoming? That's kind of what the relational environment means. Looking at the intake process, are those pretty programs and services? Looking at the community partnerships, and then making sure that our feedback and evaluation is present, and that we're learning from that feedback and taking that feedback into account, right? So again, so many similarities with ACRTI and SADI that we can already see. Kind of similar to the diagram that we wanted to show a diagram of ACRTI. So it really is a long-term transformative process is the way that they describe it. And you can see there at the center, at the heart, kind of some of those emotional safety and physical safety pieces, survivor being survivor defined, focusing on relationship and connection and hope and resilience. And outside, we see those major frameworks of being trauma-informed. Again, the holistic, if we're comparing that to SADI, the holistic approach to providing support for survivors is essentially there at the center here as well. And thinking about those other pieces of being anti-oppressive, anti-racist, taking into account culture, being trauma-informed, and focusing on DV&SA advocacy. So with our comparison here, we wanted to kind of give you a side-by-side, right? Because it can be a lot to read. Let us tell you, it's a lot to read, both of them, and to compare and contrast. And we wanted to make this really easy for you all. So with SADI, it's specifically sexual violence. I'm repeating this so much. Did I tell you that it's specifically sexual violence? And we'll be saying that over and over, right? So SADI really gives us that view. And again, oftentimes, especially for dual programs, we tend to focus on what domestic violence services look like. And we sometimes don't shift the focus to sexual violence. And what SADI can do is really help us to remember how to put it back into sexual violence. What does that look like? What are the questions we need to ask? ACRTI does discuss domestic violence, sexual assault, and trauma, but it is primarily focused on domestic violence. So you'll see in some of the resources that they're specific for domestic violence advocacy as opposed to sexual violence advocacy. So this is a place where, as we're talking about gaps and where they can be worked together, this is one of the things that you might be able to use SADI when you're looking specifically at sexual violence. And it makes sense, right? SADI is the resource sharing project in the National Sexual Violence Resource Center, and ACRTI is with the National Center of Domestic Violence, Trauma, and Mental Health. Did I get that right? So we can see those differences there where we can already start to see them, where we can overlap them. We see the similarities. I talked about this a little bit when we were looking at the ACRTI diagram, that across the table here, we have SADI has the anti-oppressive framework. It's culturally rooted and community and systems focused. And that's equivalent or parallel to ACRTI's cultural, historical, community context, and human rights and social justice, right? They're both rooted in trauma-informed care, trauma-informed approach. Some of the words are slightly different. Some of the way it's organized is slightly different, but they both have those core pieces, which again makes it really helpful to be able to like look at both of them and make them work together. We talked about these pieces. The only thing that I will add here is that the services across the lifespan focuses on a sexual violence survivor over the course of their life, right? We know that there can be assault or sexual violence that is happening from a young age all the way through an elder or an older person, right? And we have to focus on how that looks differently for them. Whereas for ACRTI, and Brandy, please please correct me if I'm wrong, but with ACRTI, it focuses a lot, it's different with domestic violence witnessing for children and youth, right? And the whole family. So there's a little bit extra in SADI for the services across the lifespan, but ACRTI does focus on care for children, youth, and the whole family when working with survivors of domestic violence. So just wanted to note that piece. So some of the available resources with the SADI framework and the ACRTI framework, one of the things that I would highly recommend with SADI is that there's resources in both English and Spanish. There's some of the things are translated into Spanish, are available in Spanish. So if you wanted to use those pieces with Spanish speaking communities, there is that piece that we're excited about. ACRTI, I only found things in English, and again, Brandy, correct me if I'm wrong. And if you could help us find them, that'd be great. But I couldn't find any in Spanish. Not to say that you couldn't translate it or you couldn't make it work for you if you're working with Spanish speaking populations, but SADI does have that you could incorporate if you're using ACRTI. They both have webinars, they both have toolkits, they both have handouts. SADI has those long reports, and ACRTI has some additional support guides to help guide you through that. SADI doesn't have some additional support guides for working through the toolkit and the process and the training and things like that. We have added on here links to where you can find these resources on both the resource sharing project and the webinars for ACRTI. So you will have access to this, and I think they're going to pop in those links into the chat box as well, so you can have them. Thanks, Brandy. Brandy mentions, I think they just have resources in English at this time. I'm not sure if the National Center will have language beyond English when they launch their new website in the future. Thank you. Yeah, so that'll be a good thing to keep an eye on. Great. Ooh, how we doing? A lot of like stuff being thrown at you. Feel free to chat into the chat box. Any questions or comments that you're having as we're going through this? All right, so let's go into the toolkits. So for ease, for simplicity, we have decided, since there is a lot of tools, that we're going to focus toolkit to toolkit. Right, that made it simple for us and comparing the assessment to the assessment, and all the other resources that come with SADI and with ACRTI. They kind of grow from these toolkits, right? So these are your initial toolkits, your initial organizational assessments that help you think about what types of services or what types of enhancements you might be able to do with your services at a later time, or if you've already done an organizational assessment, just things to think about, right? So we have picturing your program, planning for organizational growth. This one is a really nice, big, thick toolkit. And then we have the building cultures of care from SADI as well. Now I understand why the Instagram people do the hand. And then we have the tools for transformation, and you see those images on the screen as well. So 2 of them are from SADI that we're going to be talking about, and 1 is from ACRTI. We are also going to be using SADI as the heart of the comparison. So these sections that we're going to be going through, it's going to be focused on SADI, and we're going to share the equivalent or the parallel with the ACRTI toolkit to see where those gaps are, to see where one can fill in on the other and where they can work together. We won't review each section because we would be here for like 3 hours and we didn't account for that. So we'll review we'll highlight some of the trainings or some of the sections, and we will be sent the PDF that we will be sending will show some of the hidden slides we created for some of those other sections, so you can go through and review them. For those of you who are joining us in Spanish, we're happy to go through those at a later date with you if you wanted to kind of chat about that a little bit in Spanish. So the first section is readiness for change, right? One of the things that SADI found was we have to be ready for change. We have to be ready to grow. And so in this section, it was to spark intentional conversations about the program well-being and capacity for change, right? And to really help the team, the organization as a whole from different parts of the organization to have these transparent and open conversations about the program's well-being and capacity. So we see that there is an equivalent to ACRTI in the toolkit section 1, which is before you get started, preparing to use the tool before you get started, right? So it kind of ACRTI gives you questions to think about as far as how are you going to do this process? Are you all ready to do this process? Who is going to be part of the conversations, things like that, in a similar way that SADI does as well. What we found is that the toolkit from ACRTI gives you kind of a general sense of think about your process. Think about these things as you're thinking about your process. And what SADI does is it gives you a process that you could use or adapt to your organization's self-reflective work, right? So if you're like, I'm not really sure what process, what it worked, you can start with SADI using the ACRTI piece. You can start with SADI to kind of think about, okay, how are we going to do this? What is this process looking like, right? So part of this process is that SADI has these 5 guided reflections. And again, we won't go through all of these today, but we do have those hidden slides that you can review. So there's an anti-racism commitment to look at where is your organization, where is your agency on that, on your commitment for that. Stable and empowering leadership. We will go through that in detail. Support for staff, openness to change, and openness to learning. So the other one we won't go over today is that openness to learning, but we'll go over the 3 in the center. So when we're thinking about stable and empowering leadership, what SADI, what the toolkit does and what this guide does is it mostly focuses or it gives us a picture of the stability of leadership and the leadership's empowerment practices. So our ACRTI parallel focus area here is focus area number 2, which is staff support and supervision. And this one mostly focuses on staff supervision, not really about engaging staff in problem solving and decision making within the organization. So we did see that as a gap in ACRTI that could be filled with SADI, right? In ACRTI as well, the focus area seems to be one way rather than reciprocal. So for example, there's points that are focused on providing survivors the opportunity for feedback and leadership to provide staff feedback, but there isn't a process or questions evaluation for staff to provide feedback about the services. It also doesn't evaluate leadership or the readiness of leadership. It makes the assumption, I guess, if you're looking at this toolkit, you are ready to do this, but SADI kind of really helps evaluate where leadership is as well in terms of where your organization is at, right? So we see for stable and empowering leadership, we see questions like, how long has the current leader of your program been in place? Do they have a plan to exit the organization in any time soon? How do your program's leaders practice empowerment? So do they share power? Do they step down when appropriate or necessary? Do people in leadership positions encourage staff to solve problems together? And have they begun conversations about serving survivors of sexual violence in new ways? Right. So again, in these pieces, we see that focus on sexual violence again. And these are some of the questions and reflections that we didn't see in ACRTI. This next piece is support for staff, which helps assess how the program supports staff. We talked about how central this needs to be. In this piece for SADI, the Building Cultures of Care toolkit, along with the picturing our program assessment, really helps to look at that organizational commitment to staff growth and wellness. So this is something that you would use those 2 tools together. And what I really appreciated about the Building Cultures of Care is that it also helps us to think about our interns and volunteers and including them as part of the conversation of how we're focusing on their well-being, especially since, oftentimes we're not paying them. Right. And so thinking about ways to include them in this. The ACRTI equivalent focus area is looking at focus area number 1, organizational commitment and infrastructure, and focus area number 2, staff support and supervision. This one is a great blending opportunity, we felt, to be able to fill in some of the things that both are missing with each other. And we, if you're choosing SADI, you could supplement with ACRTI, or vice versa. If you're using ACRTI, you could supplement with SADI. One of the things that we noticed that ACRTI was missing, for example, was, again, it doesn't evaluate the leadership specifically, and particularly it doesn't evaluate the views and values about how they understand trauma and how to build a culture around survivor staff, right? I could say so much about that, but I'm looking at the time and want to make sure we get through this. So some of the questions on this section, you'll see things like, how does your program attend to the well-being of staff? Do you believe your program's leadership understands vicarious trauma and provides appropriate supervision to support to mitigate it? And do you believe the program has an organizational culture that is respectful of staff who are survivors? So oftentimes when we think about self-care, we say that the advocate is the one responsible. It's self-care, right? You need to take care of yourself, make sure you're taking care of yourself after work, make sure you're doing things that bring you joy, et cetera, et cetera. But oftentimes we forget about that community care, where there has to be pieces in place at our organization that allows for self-care or allows for support and community care to support staff and mitigate that vicarious trauma that is coming from work. So this section really helps to evaluate that. It also helps to rethink about how we welcome survivors as part of our organization in terms of staff, interns, and volunteers, which often we have an arbitrary date or an arbitrary amount of years that they need to be past their trauma. So this also helps us think about, why do we have that? What is the purpose? What does it do? Et cetera, et cetera. So the next section that we'll review in this portion of SADI is an openness to change. So what this really does is it provides a snapshot into how well the program learns from change and uses change to improve the quality of work environment and services to survivors of sexual violence. So we talked about this a little bit at the beginning, right, of the importance of being able to use information to change and grow. The Building Cultures of Care Toolkit also talks about the importance to look at and incorporate these pieces into strategic planning, into succession planning, and sustainability planning, so that there is consistent, once change has happened, that it is consistent, right? So the pretty parallel focus areas are number one, organizational commitment and infrastructure, and number two, staff support and supervision. Again, I mentioned this earlier, I touched on this a little bit earlier, but in thinking about a gap with ACRTI, it focuses on how to receive feedback about staff and for staff to share grievances, but it doesn't necessarily reflect on staff and community involvement in the feedback and decision-making about services for sexual violence. So this SADI set of questions could really be a great tool to kind of dig a little bit deeper into that in terms of how we get our information, right? In the feedback and evaluation section of ACRTI, it focuses on getting feedback from survivors who have used our services, who have come to us already, but it doesn't give us an opportunity really to learn from the community and those who have not come through our doors to learn why they aren't coming to our doors, so that we can make those changes so that they do feel welcomed. So we see questions like, do you believe that differences of opinion are valued within your program, right? Do the program's leaders provide time, resources, and venues for staff to reflect and improve on sexual assault services? We know that the people that are frontline staff are the ones that often know what's working really well and what's not working well, and they have ideas about how to make it more efficient, more useful, and helpful for the survivor's healing journey. So is there opportunity for that? Is there opportunity for us to spend some time reading, learning about best practices, that professional training? And also, how do survivors and community members participate in your organization, right? Are they volunteering? Are they interning? Are they providing, are they giving donations, right? How do we incorporate survivors and community members in our organization? So at this point, I'll go ahead and turn it over to Itzel, who will guide us through a couple of the other sections, starting with making survivors' pathways visible. Itzel?
So on making survivors' pathway visible, it highlights how survivors of sexual violence experience your program, including access and moving through services. In this section will help map diverse pathways for survivors of sexual violence, access and use programs. In this section, it talked about the importance of community mapping and organizational narrative. We know communities and organizations change, and so do their needs. It's important that we take the time as an organization to sit down and map out who are our allies in the community and who will help the organization, who in the organization understand and identify the people willing to help. The organizational narrative helps advocates put themselves in the survivor's shoes at the time of accessing services. So think of how might this space make a survivor feel? The ACRTI parallel focus areas are focus area number 3, physical, sensory, and relational environment. And the focus point number 6 is community partnership. On focus area number 6, community partnership talks about collaborating with community, but lacks community mapping and organizational narrative that SADI does have. ACRTI talks about collaborating with partners, healthcare, mental health, substance use, child welfare, child service, serving systems that SADI doesn't focus on. We'll see questions like, how might survivors of different types of sexual violence feel as they look at pictures, books, and decor at your office? The organizational narrative, putting yourself in the survivor's shoes, is helpful to figure out how survivors feel at the time of accessing services. ACRTI doesn't have that type of mapping, while SADI takes you on a tour through your organization. What will you learn about how you can support them in specific journey? And are there choices in privacy and seating? So asking survivors if they feel comfortable, if a shared space is comfortable, if they're comfortable talking in front of multiple advocates, do they feel comfortable sitting on the other side of the desk? Beside you, perhaps? Do the pictures on the walls or posters resemble the people you serve? Is your organization wheelchair accessible? Is there language accessibility? In this section, people to people, it's tools for exploring internal sexual violence relationship or resources and networks, the way people collaborate, share knowledge, provide information to each other, communication patterns, looking at who in the organization is a specialist on topics. So who do survivors talk to for sexual assault topics? SADI is more specific to underserved communities, essential for problem solving and meeting the needs of survivors of sexual assault, and there is no ACRTI equivalent or parallel.
And I just wanted to add here really quickly that the mapping, the social networking activity that it has, it is geared towards dual and multi-service programs, but it can be adapted for those of you who are working in a standalone. So for example, if you're thinking about who in your organization you go talk to for a sexual assault case or a sexual violence case, with a standalone program, you might think about if you have specialties or areas of expertise as you're working, if you have a court advocate, a medical advocate, you can adapt it to kind of think about, hey, how much of a workload or a caseload is on each specific person, and who do we go to as the expert in that, is a way that we would suggest adapting it to a standalone program.
Thank you. So questions you will see is, which person do you go to for assistance if you need help serving a survivor of sexual violence? So some agencies have assigned advocates, which makes it challenging because there's only one person serving SA survivors, giving the advocate more of a workload. If you notice that there are only 1 or 2 staff routinely listed, how might this make it challenging to enhance sexual assault services? So how it felt like for me as the only bilingual advocate was overwhelming at times. So having to work with monolingual clients and also do sexual assault advocacy was challenging, especially not being the designated advocate to talk about sexual violence with. Again, these are SADI questions ACRTI does not focus on. Maria, I'll pass it to you.
Thanks, Itzel. So did we mention that SADI focuses on sexual violence enough times now? And we'll continue to mention that throughout still. So in this last piece of the toolkit for SADI is pages to practice. So essentially it's about thinking about our policies and procedures and what those look like in practice, right? Because sometimes we have a policy or procedure and we don't necessarily follow it, or it doesn't have those intended things that we wanted to do actually in practice. So what this helps us is look at these 3 focus areas in this section of looking at organizational identity, organizational structure, and policies and procedures. There is this parallel for ACRTI of sections or focus areas number 1, number 4, and number 5. Number 4 being intake process and number 5 being programs and services. SADI includes a checklist for reviewing the documents of your program in this section, and it also has a 5-step process to engage in this portion of the assessment. So kind of what we talked about earlier, ACRTI kind of really helps kind of the broad thinking and thinking about the process, while SADI can be really helpful as you're working through that to have an example of a process that you can use or that you can adapt to fit your organization. So looking at the organizational identity focus, these are things like how the program's name, mission, strategic plan, outreach materials, and online presence defines the organizational identity. So it includes looking at your tagline and logo. Does your tagline and logo, will somebody see that and say, oh yeah, there are sexual violence services at this place. This is for me as a survivor of sexual violence. Similar with the website, we mentioned this earlier. Does your website show that you do have an expertise and you do have a program on sexual violence? Does it have information about sexual violence? Do your brochures have that? Do they look like the people that are in your community that are welcome to come to your organization? Similarly, your social media accounts. Do you, if you have services in different languages, do you sometimes post on your social media in those languages? Do you include in your social media accounts updates and best practices or news or current events about what's happening with sexual violence as well as domestic violence? Thinking about your budget and fundraising. Do you have budgeting and fundraising specifically for sexual violence services? So we do see the ACRTI parallel as well in that first focus area in the organizational commitment and infrastructure. It provides those basic questions and items to strive for in similar areas as SADI does. But again, it doesn't have information about analyzing the name, the strategic plans, the website. It has like this broad question about it. And in those questions, it also doesn't have these sexual violence specific questions and things to consider like SADI does on sexual violence, right? So things like, does the name and tagline make it clear, like I mentioned earlier, that sexual violence services are in fact an integral part of the agency? And looking even percentage-wise, what percentage of content relates to sexual violence on your website versus domestic violence, right? So thinking about those pieces is really important. Is there anything that you'd like to add here, Itzel?
Yes, so my personal experience working at a dual or organization, and how organizational identity is so important is because if we don't address who we are and who we serve, it can impact the healing process of a sexual assault survivor. So some survivors shared they didn't share their lived sexual violence experience because they didn't feel they were in the right place to receive services. And that's why it made a huge impact on survivors' experience.
Yeah, thanks, Itzel. So with that example, right, we can see how important it is that even our identity, we have to make sure our identity when we're dual or when we're standalone, that it really does focus on that sexual violence piece. So we won't be looking at all three of these sections. So the last one we'll look at is the policy and procedures focus, which is really helpful to review both personnel and service delivery policies and procedures. It also notes, SADI also notes how written policies are actually put into practice, right? So that's what I was talking about earlier. And again, looking at how programs are happening and also the support that we give personnel on this. So similar to earlier, really ACRTI has these parallel focus areas as well. Focus area number 1, focus area number 4, and focus area number 5. It again provides those basic questions and items to strive for in those similar areas, but it doesn't go in depth about evaluating your consent policies, having your directory of referrals that are specific to sexual violence and updating those. But it really does cover a lot of similar concepts. This would be another great section to blend if you're using both, especially with those staff policies, the support and well-being, to be able to use both questions, both tools, to be able to capture all of the pieces specific to sexual violence. So for this one, we see questions like, how do intake procedures address the full continuum of sexual violence experiences, right? Do we talk about, or do we have an option for survivors to come in and talk about sexual harassment? Do we have space for survivors to talk about about rape specifically or other sexual violence experiences. That's going to be important for us to think about in our intake procedures. And then how do shelter policies and procedures explicitly welcome and support survivors of sexual violence? This is something that we see a lot as well, how we talked about earlier, that oftentimes we just tag and sexual violence to our support, to our resources, especially in a shelter setting, right? So are there specific things that we have set in place to make sure that survivors know that yes, you qualify for a shelter for sexual violence, or we will have specific resources available at our shelter and services to specifically address the nuances of needing shelter in a sexual violence situation. So you've gone through all these questions, you've done these assessments. What happens next? Both have pieces that are helpful in order for you to think about what to do with this information. What I really love about SADI is in the toolkit, it has a specific section at the end of the toolkit that and some worksheets to discuss kind of what happens next. And I love this idea of throwing a party to celebrate your hard work, because it's hard. They're hard conversations. It's difficult to look at where we might need some work, right? And I'm sure it's going to take a long time. SADI suggests 3 to 6 months for going through this assessment. So that's quite a commitment, right? So appreciating the people that had these hard conversations is a really cool thought. It also shares that you'll want to collect all your notes and materials into one comprehensive report to think about what you've learned from going through this process. And then it helps with some questions as well. What are some small changes that you can do? What are some big changes that you can do, right? And what will that look like? Also within each section in SADI, they have next steps. So like in assessing change, right? And thinking about your stable and empowering leadership. At the end of that section, it also has a worksheet that you are able to think about what's next, right? So it kind of guides you step by step in each section, and then it also gives you an overall one. ACRTI is, it doesn't have like a comprehensive section like this, but it does have in Appendix C, it has worksheets per focus area that help you evaluate like what are your initial actions going to be based on what you've learned, what goals are you going to set, and how will you know when you've met your goals? So that worksheet is really helpful as well in that section. There is also one of the gaps that we noticed in SADI is that ACRTI does have a section of before you get started. So thinking about how you know, like, are you ready to go through this process? SADI doesn't necessarily guide you through, are you ready? But it helps guide like the questions after that, right? Like ACRTI helps to ask, is this the time to have these conversations with staff and with leadership? Will leadership accept this process, right? So I would recommend that you might want to use the before you get started in that toolkit, and then again, use SADI as kind of that process. So how do you choose? This is the big question that we all came here for this morning. They overall are both really great tools, right? And they can fill in the gaps of the other, and you can also use them to supplement each other when there are gaps, right? It is also helpful depending on, we all learn differently. We all process differently. So looking at both of them can really give you different ideas on how to ask some of these questions, how to process some of these, and how to evaluate your assessments, right? So if you want to use both and kind of compare of like, how did this ask this question? Oh, that makes more sense to me than the way it was asked in SADI, right? And again, using them together is a really good tool. We have found that with the SADI framework, you can dive a little deeper into sexual violence because, did we tell you, it focuses on sexual violence. So like those pieces are really, really important in a project like this when you are trying to enhance those services of sexual violence, right? Whatever framework you choose, make sure that there is that focus on sexual violence, right? Because that's important. We at CCASA do encourage you to use SADI as a core, like we did here, since it does help us to keep the focus on sexual violence rather than defaulting back to domestic violence. And a lot of those questions really have very specific things to think about our very particular sexual violence program needs, right? To evaluate those, to think about with the other tools that SADI has, to think about how to better services. What do services look like? What are comprehensive services for sexual violence? How are those different than domestic violence services? So again, we highly, highly recommend to use SADI. If you have been using ACRTI and you feel comfortable with ACRTI, we do recommend that you supplement that with these SADI questions because it gives you kind of a little bit more focus again. We want to also make a note that this was a lot. We didn't cover all of it, right? And here we are at 11:20 almost. And it's a lot. It's a big commitment. And so we just want to make sure that we let you know that you don't have to enhance all of these at once. To remind you that it is an ongoing process. It's not going to change overnight. So take your time, take a breath. For those of you who are DVP projects in the Sexual Violence Services Project, your statement of work states that you have to have at least one EDI goal or an ACRTI goal. So focus either on what's the most needed or even what are you most poised for success, right? Because start with a win. We start with a win and we get encouraged to keep going. But just because you only have one ACRTI goal required, that doesn't mean you can't do more, right? So just take a look at what your capacity is and what's realistic for your program to continue to enhance those sexual violence services. And we encourage you all to reach out to us. We did this research for you so that you didn't have to spend the time doing it, right? So lean on us when if you have questions about deciding what's the best for your program or how to blend these tools together, or adapting the processes, please do reach out to us. We can support you one-on-one in technical assistance matters of, you just have a specific question. We can support you in completing those assessments as well. That is something that for those who are DVP projects, you will be doing an assessment. So we can help you with that process. For those of you who are not a DVP program, we can still help you through those processes, right? So feel free to reach out to us as a team as you're doing this work. We want to support you in completing that the best that we can. We also have a training calendar specifically for DVP, but also our webinars, right? So keep an eye out for that. If you're not signed up for our e-digest, please do on our website. Remember that introduction to SADI that will be happening at the end of March, on March 22nd. We can also provide agency specific training. So if you're looking at maybe your foundational training for new staff on sexual violence, we have one online, completely self-paced, that you can have your staff go through and get that foundational training. We have online learning center that you can do that online. We can do specific ones for your agency, right? So if you want more information about SADI, if you want support with ACRTI, if you want some of the trainings that are covered within the frameworks like anti-oppression, trauma-informed care, service provision, please reach out. Let us know what you're needing. We're here to support. So to end, we wanted to leave you all with, for those of you who are DVP project folks, these are those of us at CCASA who are working directly with that project. So I'm the primary lead. Reach out to me, anything that you need. You can reach out to Itzel as well. Itzel's focus is rural programs and specifically working with Latinx survivors. So reach out to Itzel if you have a question about that, or reach out to me and I can get you to Itzel, whatever feels most comfortable. Agueda and Bree are our AD and our ED, sorry, there's that language again. So they can help you if you want to reach out to them about specific topics of management, right? So if there are managerial things that an ED has or a supervisor has, they will be able to help a little bit more depth with that. But again, if you reach out to me, I can get you connected to the correct person on our team if it's not me. And everyone else, feel free to reach out to us too, or anybody on our team, as maybe you have been doing already, to get that TA and training support as well. Wow, I didn't think we were gonna make it. So that's what we have for you all. At this point. So we will go ahead and open it up, leave these last 5 minutes for questions. So I'll go ahead and stop sharing and see any thoughts, questions, comments. And feel free to unmute yourself as well if you would prefer to ask your question or state your comment that way. Oh yes, please do fill out that survey. You'll also be getting that link in an email. And you know what I will try to do for those, for our Spanish speakers on the call, don't take this one. I'm gonna do a quick translation and I'll add that to the follow-up email so you can have that in Spanish. All right.
Maria, this is Maria Limon. I do have a question for you. And this may be kind of way out there, pero forgive me for my ignorance and lack of perspective. So one of the challenges that I see in terms of providing that solid foundation that survivors need in order to go ahead and move ahead is taking into account the totality of their context. In the application of either SADI or ACRTI, is there anyone that addresses in depth or do they provide any perspectives around supporting people who, for example, have been survivors of wartime violence? I'm in El Paso right now, and there's a lot of people here who have survived torture as political torture, or, you know, the torture of the sexual violence and the torture of during their experience of migrating from, say, Central America into United States. Are there, do either of these programs take, have an opportunity to, I guess, get a handle on that?
Yeah, so that's a great question. I think that because of both of the toolkits and frameworks have a focus on being trauma informed and focusing on trauma and how trauma impacts that healing process, they both do have the opportunity to think about those intersecting and complex and multiple types of trauma in evaluating our services, right? So in the Building Cultures of Care toolkit for SADI, they have a whole section on understanding trauma and thinking about what those pieces are. They use the SAMHSA model, SAMHSA, that I always forget what it stands for, but it's like the Substance Abuse and Mental Health
Services Administration.
Yes, thank you, Maria. So SADI does have a piece talking about that model, training on that model, thinking about the overlaps of the types of trauma that survivors come with.
Okay.
So I believe ACRTI in their modules as well, they have a whole module on trauma and understanding trauma and its effects. So it does provide some opportunity for that. It might not specifically, but it is embedded in terms of learning about trauma and its impacts.
Okay. Okay. Yeah, because that's something most of us are not equipped to deal with. In all honesty, yeah. Well, thank you. Thank you so much.
Yeah, thanks for the question, Maria.
Mm-hmm.
Any other questions or comments that folks have?
This is Agueda. I think that one of hold on.
No, go
Yeah,
for it. Go for
I'm
it.
in the Spanish channel, so and I don't know how this is gonna go. So I'll do it. Okay, ¿cómo nos vamos? Okay. So una de las cosas importantes que tenemos
Okay, I'm on the Spanish channel. So one of the important things that we really want to keep in mind is that when we are selecting, when we're comparing both programs, we need.
Sex violencia. Dígame. Correcto. Claro que sí.
Well, oh.
Sorry, y'all. I wanted to make sure that folks, the ASL interpreters had access to the English interpretation before we continued, but it looks like we're set.
You have chosen the English channel for interpretation, so you can make sure to hear the interpretation in English as well.
Gracias a ustedes. Disculpen por no tener eso en cuenta.
Yes, thank you all very much. Thank you for keeping that in mind. But one of the things that is really important to consider is that SADI is really focused on that spectrum of violence, right? The sexual harassment, sexual violence as an oppression tool. And when we look at ACRTI, that one is more focused on different aspects of it. but it is very focused on domestic violence. So it does take pieces of sexual violence and child abuse. So it does have different, it has different components to it, but we do need to keep in mind that really that in general, right, the umbrella is when it's truly inclusive is when we're also talking about sexual violence as a tool, right? Because it's really broad, because when we use that, we're including domestic violence, we're including intimate partner violence, we're including sexual harassment against child abuse. So we see that trauma that happened when they were children that carried over to when they were adults. So it's a lot more broad. It's more of an umbrella term, right? So how can we make sure that we're broad enough to make sure that we're including that? And I think that SADI does have that lens that helps us see beyond certain populations, right? And going back to Maria's question, if we take a look at ACRTI, ACRTI doesn't have that centralized focused on the survivors necessarily, right? But when we take a look at SADI, we see that SADI really is centralizing their focus on, or focusing on, that sexual violence and the people that are working with them to make sure that they're more inclusive of the different types of oppression that they experience, right? There's an intersection between oppression and sexual violence. So I don't know if I'm making sense, but thank you very much.
Gracias, Aida. Thanks for including that for sure. We certainly have been moving towards, at CCASA, with your leadership of looking at it, the sexual violence as the overall umbrella. So thank you for bringing that in. Valeska, was there something you wanted to share as well?
No, I'm good. Thank you very much for asking.
Awesome. Well, thank you all so much. We're 4 minutes over. We appreciate your time. Thank you to our interpreters, both Spanish and ASL. We appreciate you so much to be able to make this a welcoming space and an accessible space. Like Sarah said earlier, please do fill out that survey. We've already gotten some coming in, so thank you. And keep an eye out for an email. Last reminder for the Spanish folks, Spanish-speaking folks in the room, give me an hour and I'll translate that that evaluation so that y'all can do it in Spanish. Thank you all. Have a great day.
Thank you everyone for being here.